Hi, Millie. My name is Natalie. I'm going to be your nurse today. Doctor ordered some medications for you, so if that's all right with you, I'd like to administer them. Can you tell me your name and your date of birth, please? Millie Larson, date of birth 1/1/1936. All right, perfect, Millie. Do you have any allergies to medication? No? Okay, perfect. So, first I'm going to do some hand hygiene. And I'm going to do my first medication check. I'm going to let you know the medications that the doctor ordered. I have all my supplies here. I have he wants you to have an IM injection, so I have the needle and syringe. I have your oral medications. I have my gloves and my hand gel. Okay. So first, Millie, we're going to give you your oral medications, okay? So doctor here ordered Docosate sodium 100 milligram tablet, and he wants you to take that by mouth. Since you're having constipation, that's going to help you go to the bathroom. So I'm going to go to the medication cart. Going to look for your medication. I have a cup here that's labeled with your medication. And here is your pill, your Docosate sodium, 100 milligrams. Okay, that's going in your medication cup. And here is, I have some water for you, Millie, also. Okay, Millie, I'm going to do a little hand hygiene. Make sure I do my 3 checks. Make sure you're the right patient, the right dose, the right medication, the right route, the right time, and the right documentation afterwards. So, Millie, like I said, we have your Docosate sodium, 100 milligrams. I have your Docosate sodium, 100 milligrams. Doctor wants you to take this by mouth. So, just gonna plop your pill in your cup there, just labeled with your name. Here you go, Millie. Okay, perfect. All right, Millie, so now doctor wants you to have an IM injection. He wants you to take 2 milligrams of haloperidol. So I'm just going to get that ready for you. He wants that to go in your ventrogluteal muscle. So if you could lie on your side for me. I'm just going to expose your hip here. I'm going to clean off the medication top with this alcohol prep pad. Make sure I have the correct medication. 5 milligrams of haloperidol. Expiration and lot number's great. With a 3 cc syringe. Throw that in our trash. That in our trash. First, I'm going to drop your medication. I have your syringe labeled here. Correct dose and your name. So the order's for 2 milligrams. So we're going to drop 2 milligrams. Aspirate air. Going to hold the cap in my hand with this side up. Inject the air. Turn the bottle upright. Extract your medication. Make sure I have my 2 milligrams. Perfect. Going to put the cap back on. Dispose of that in my sharps container. Twist on the correct needle that I'm going to inject you with. Next, I'm just going to make sure that I have the right dose of your 2 cc's. Okay. So Millie, while you're lying on your side, I'm going to identify the correct landmarks. We're going to do the ventrogluteal site. So we're going to look for the greater trochanter, and I'm going to place my hand with a V shape with my finger and my thumb. Also, I'm going to palpate for your iliac crest. And then I'm going to go right in the middle here. We're just going to clean that area off, starting from the inside out. Just going to let that dry. I'm going to give you your injection. We're going to remove our cap. I'm going to make sure my bevel is up. I'm going to use the dart technique. So with my hand in place, just going to insert the needle, insert the medication, withdraw, recap, or not, depending on your protocol for wherever you're working. I'm going to dispose of my needle. Give you a little gauze. Dispose of our trash. And to dispose of my gloves for my hand hygiene again. And put you in the correct position. Make sure you're comfortable and your call bell's in reach. Anything else I can get for you, Millie? All right, have a good night.